People are getting frustrated over the late COVID-19 test results. Just a few hours ago, the state said it's trying to work through a backlog of the tests. For more on this, here's 9 Wants to Know reporter Jeremy Hohola.
When carloads of people showed up to get tested at the drive-up location in Lowry last Wednesday, they were told results would come within 72 hours.
I mean, I just want to know that I didn't put anybody at risk.
People like Ben Roy grew frustrated when that 72-hour window passed, prompting people like him to call hospitals in the state, only to receive even more confusion.
You know, the big thing I want people to know is I think that nurse at Denver Health that hung up the phone on me was tired and stressed and doesn't know anything either. And, you know, so I feel for them. Like, this is just, everybody is caught off guard. And
just after our interview with Ben, he got a call saying he was negative. This afternoon, the state's health department acknowledged there's a communication gap over who should be notifying people who are negative.
So we are working through our backlog. The state lab is now working 24 hours a day, 7 days a week. We've hired additional staff members. We have hired additional people to work on calling out results. The system that we normally use is not one that a lot of our providers are familiar with.
For now, the state can only work through 250 tests a day and is waiting on more equipment from the federal government to expand testing ability.
We are doing everything we can at the state lab to work through the backlog. As we know, the volume of testing that has been required in response to this incident has been overwhelming. We have not had as much support from our private partners as we expected to have.
Since the state started testing, the numbers reveal more testing every day. As of Sunday, more than 700 results have been reported, with the large majority testing negative. Colorado has nearly 200 positive tests so far, with that number expected to increase. And just before this newscast, the state revealed another interesting tidbit here. Private labs are not required to report their negative tests. So at this point, it's impossible for us to give you the exact context between a negative test number and a positive test number. But in the meantime, it's clear cases to continue to go up at 160 today compared to 131 yesterday. Again, the state says it's important to test. That way they know where outbreaks are happening so they can pivot resources when necessary. Back to you guys.
All right, important that those positive tests from private labs are being uncovered, but maybe those negative ones are numbers we need as well. We'll have to see how many tests
tells a
are getting
story,
done.
the testing.
Yes. Thanks, Jeremy.